The decision of what to eat is certainly important. In the case of mental health, protein plays a really big role. The amino acids that are found in protein, whether it's plant protein or an animal protein, those amino acids become the building blocks for our neurotransmitters. So the things that make up serotonin and dopamine and melatonin and all of the neurotransmitters that we think of as creating our mood. So really important to have the building blocks for those.
Welcome to the Good Life Coach podcast. I am your host, Michelle Lamoureux. The intention of this show is to awaken you to your fullest potential. Join me each week for inspiring interviews to elevate an area of your life, as well as interviews with women entrepreneurs who are creating success on their own terms. Each episode provides actionable tips to guide you to design a life you love. Hey there, it's Michelle, and welcome back to the show. We are jumping right in today to talk about mental wellness, and joining us is Dr. Heather Sandison. Dr. Sandison is the founder and medical director of North County Natural Medicine and the founder of Marama. She specializes in neurocognitive medicine and neurohacking. She has been trained to specifically address imbalances that affect the brain, including autism, ADD, ADHD, depression, anxiety, and Alzheimer's. Dr. Sanderson believes in the power of the body to heal itself and is dedicated to learning all there is to learn and know about the brain. Welcome, Heather.
Thank you so much for having me, Michelle. It's a pleasure to be here.
I'm so happy you're back again. And I am going to link in the show notes that we did talk about optimizing brain health in episode number 51. And that was a really popular episode. So thank you for your time on that. And look forward to diving in today. I'm just going to say before we get into the interview that I want to remind everyone this podcast is for entertainment purposes only. Nothing discussed is intended to be considered advice for your mental or physical health, and any issues with your health should always be directed to your trusted medical providers. Okay, so on that note, let's get into it today. Heather, I am curious. We are talking about mental wellness today. What kinds of issues do patients typically come in for? And I'm going to layer that with a part two, because I wonder, because you're a naturopathic doctor, if people are coming in for not feeling well and not realizing maybe it's related to other issues, because I know one of the benefits of seeing a naturopathic doctor is you dive deep into emotional health, not just physical health. And so you may even be asking questions like, how are your friendships? Are you do you have do you have good social connections? And people may not even realize there are other underlying issues going on emotionally that may be contributing to some of their physical symptoms.
Yeah, really one of the tenets of naturopathic medicine is to treat the whole. So you really can't separate these pieces. Your digestion is related to your mental health, just like your big toe is connected to your foot. Like everything is connected, and to separate them out does them a disservice. Although we can be reductionistic and sometimes glean more information, we have to remember to put the part back into the whole. That context is so important when it comes to mental health in particular. You're absolutely right. Sometimes people are surprised by the depth of the intake paperwork that we have. And then also I set aside at least 75 minutes to have one-on-one. Sometimes it ends up being 90 minutes or more with a patient the first time that we chat. And that's because there is so much for me to learn. And there's so much I can't learn just from you filling out a form. Really, exactly what you just mentioned. Like, what are your social connections? Like, I always ask about relationships. The big kind of 3 to 4 things I ask about in terms of stress is, 1, what is your stress management practice? Because we should all have one. 2, what are your relationships like? And not only do I mean your romantic relationships, but with your children, with your siblings, with your parents, with your friends. What is that like? What's the support around you? And then 3, of course, finances can stress people out. And 4 is your home. If you're in the middle of a remodel, or if you are in the middle of moving, or you keep moving, you haven't had that opportunity to create those good social connections because you keep bouncing from state to state. Your husband's in the military or you're in the military. For whatever reason, people sometimes move frequently, and that can be really, really stressful. Or in my practice, of course, a lot of people suffer from mold illness. And so they're having to move. They don't feel safe in that home because it's toxic. So yeah, lots of components that I kind of put in the stress bucket that can be certainly a big influence on mental health. And yet there's all of these other things, that people wouldn't typically put in there. Like, are you having a bowel movement every day? How much water are you drinking? What have you been eating lately? All of those things also contribute to exercise, of course, how you're feeling from a mental health perspective.
Okay, so there's so many layers. Maybe you could take us into what's the foundations for mental health?
Yeah, okay, so that was kind of the list of it right there. So foundations for mental health start with like what you do when you get up in the morning, right? Certainly sleep, like we can even go backwards a minute. Sleep and getting to sleep consistently, getting enough sleep, that is so foundational, right? We've all had that feeling. You're a mom, I'm a mom, right? Like that, the stress of having a newborn, so much of it is the deprivation. Not only the like anxiety of like, is my child still breathing, but just the crazy that can come from not getting enough sleep. And in these, unprecedented times, I think there's a little bit of a temptation to like stay up and watch the news or stay up and get into that Netflix show because I don't have to commute tomorrow morning or whatever it is. We're just kind of thrown off. And it can be easy to throw our sleep habits off, off. And if you're getting a little bit more restful sleep, awesome. But if instead you've kind of indulged in the staying up late, getting up early, or sleeping in late, you're off your pattern, then that inconsistency can be just as bad as interrupted sleep, right? So getting really consistent and having a routine around sleep and getting whatever is right for you. Some people it's 7 hours, some people it's 10, finding the amount of sleep that's good for you and then sticking to it.
Can I ask you before you go on to the next foundational thing, because I know you talked about digestion and stuff too, which I'm curious about. How do you know what your set point is for a good night's sleep? Because you just said anywhere from 7 to 10, right? So the recommendation is, at least 7 to 8 hours or not more. I don't know. Is it how you wake up? Should you wake up feeling like ready to take on the day? Or do some people just naturally feel groggy and need that shower to wake up?
Yeah, there's different types of what they're called are chronotypes. So like your night owl and your morning person, right? And so different people have these different normals for sleep. And I used to think that it was really important to like get those hours before midnight in. And as I've talked to more sleep experts, I've kind of shifted my opinion recently that it's more about consistency and figuring out what's important for you. And there are a bunch of sleep experts in this area who can. That's what they say. It's the consistency. So if 12:30 is your bedtime and that's what's best for you, don't go to bed at 10 one night and at 1:30 a.m. the next night. Go to bed within about 15 to 30 minutes of 12:30 a.m. every night. Especially if you're like a night owl, and then give yourself the amount of time that you need. And what I've understood from these sleep experts is that if you're consistent about your bedtime, then usually your sleep is more efficient. So instead of being a person that needs 8 to 9 hours, if you get to bed at 12:30 a.m. every night, because you're a night owl, then you'll be waking up at like 7:30 or 8 and you'll feel fully rested. Maybe you only need 7.5 hours, whereas before you felt like you needed 9. But because your sleep is now more efficient, because it's more consistent, you can get away with less sleep. Now, some people don't feel like they need that much, and that's like their normal. Other people feel like they need a lot, and that's their normal, and that doesn't really shift. But are you well rested? That like hit the nail on the head. Your question there: do you wake feeling rested and ready for your day? If not, then you can't check that box that foundation is good to go.
Okay. What's the next one?
So diet. You had mentioned diet and nutrients. There's a lot of overlap here. So the question of, are we putting the right things in our bodies, right? How do we decide what's good for us or maybe we've decided it's not good for us, but we override that and eat it anyways. So the decision of what to eat is certainly important. In the case of mental health, protein plays a really big role. The amino acids that are found in protein, whether it's plant protein or an animal protein, those amino acids become the building blocks for our neurotransmitters. So the things that make up serotonin and dopamine and melatonin and all of the neurotransmitters that we think of as creating our mood. So really important to have the building blocks for those.
Can I ask you on the protein then? So I always say to my daughter when we're trying to make our meals morning, I'm like, we need some protein, a little healthy fat, and whatever else she may want for breakfast. But at each meal, you should be having that protein.
Well, there's a lot of ways to play with this, and different people will have different experiences. I typically recommend a good starting point is about 15 grams of protein for breakfast. So 2 eggs is about that. It's 14-ish. 1 egg is about 7 grams of protein. And then if you're using amino acids as a mental health therapy, things like taurine can be really relaxing. Inositol, of course, tryptophan or 5-HTP is the precursor to serotonin. That can be used. GABA is a relaxing neurotransmitter. Using things like taurine. Those amino acids, if you're using them as a therapy, you actually want to do them on an empty stomach, because then they're more likely to be that neurotransmitter backbone if you get a kind of a bolus dose on an empty stomach. So it depends what your goals are, but for just that nice even mood and to avoid the sugar crash, if you have plenty of fat and protein with each meal and even with the snacks, right? You're not having like a soda or a candy bar. And so your blood sugar is going to spike and then crash. And then you're going to feel anxious or depressed when you get into that crash zone.
So when you say things like taurine or whatever, would that be part of a supplement that you're being prescribed or like suggested that you start taking? Because, right, I was generally talking about a diet, generally speaking, in terms of getting that protein and laying down that foundation. You got your sleep and good nutrients, but that would be something that maybe somebody like you'd go see and you say, hey, you know what, let's supplement. I think you need a little boost.
You're exactly right. That would be more of an intervention versus a foundation. But like magnesium can be really great for kind of making us feel a little bit more relaxed. And that can be foundational in some cases because so many people are magnesium deficient. So yeah, but thank you for making that nuance clear, that this would be more of an intervention versus a foundation. And just to finish kind of the dietary foundation there, 15 grams at breakfast and then 7 to 10 grams for like a nursing mom or a pregnant mom. We're going to say every 2 hours after. For a teenager, every maybe 2.5, 3 hours after. And there are some adults who, can go for 4 hours or so in between meals. But getting 7 to 10 grams whenever that next meal comes up can be really important for just maintaining, again, that foundation of enough protein in the system to not supplement, in this case we're not, but to just, that foundation of building blocks that's present so that if your brain wants to make serotonin, it can. If it wants to make dopamine, it can.
Yeah, it's so interesting because I think many of us probably aren't thinking enough about that and don't realize that just what we're eating every day is contributing to how we feel mentally and emotionally and physically. So if we're not giving our body the foundation to do what it needs to do just to be, then we are actually contributing to that. What are some of your favorite sources of protein? You mentioned eggs.
Yeah. So personally, I actually have an egg allergy. So it's like every morning because my whole family has eggs and they feel great. And I just have like awful reactions to eggs. So I avoid them. But like nut butters are a great source of protein. Organic sausage in the morning, because the morning it's like that first meal. And I think it really sets the tone for the rest of the day. So we do consume animal protein in my house. And but all organic, like well-sourced meats. And then the plant proteins, like hemp seeds in your smoothie. There's like, we do some cheese, but even like protein in smoothies, going back to smoothies, like the pea milk has a lot of protein, almond milk, there's a lot of those nut milks have tons of protein in them. And then I love Nutso, the mixed seed and nut butter. And then, of course, all of the almond butters and macadamia nut spreads and all that stuff is so tasty and yummy in the morning.
Okay, thank you. Just in case people, they're going to be like, oh, I'd like some ideas. So that's great. Okay, and so you were talking about digestion, which I think we hear this, but we don't always pay attention. So a bowel movement a day is really the norm, or should be the norm.
Yeah, some people it's more than one a day, but if you're not having a bowel movement every 24 hours, that can start to make you feel bloated and irritable, right? So if we're talking about mental health and you always have stomach pain or stomach discomfort, it's so distracting, it's irritating. It's just like, it's not a setup for strong mental health, right? And then the other piece of that is it's a clue that there might be some bacterial dysbiosis, or, there could even be parasitic or viral or fungal dysbiosis in the gut. And those things, the more we learn about gut microbes, they drive everything else, right? Our weight, our mood, our, memory, so many things are driven by that microbial milieu in the gut, that if you are having symptoms, it's really important to figure out what's going on with those microbes. And can we just, is it as simple as a probiotic in terms of making you feel better?
Okay. And again, that would be done with a naturopathic doctor, right? They would help discern what was going on.
Yeah, that can be helpful. I mean, a probiotic or fermented foods, again, foundational, very foundational. You see that in cultures all over the globe as being something that really supports health. And so adding sauerkraut or kombucha, not too much sugar, but kefirs, soy products like miso, all of those things can be super helpful. Kimchi, yum. And if that starts to make you feel gassy or bloated, even more so, then that's an indication, again, that there's maybe a microbial imbalance that we would want to explore further. And you could do that with a provider.
Okay, that's helpful. Okay, so, are there any other foundational ones you want to mention? Or are those the key?
So you should be having a bowel movement every day, at least one. And then there should be an absence of gas, bloating, indigestion. Obviously, some gas is normal, but it shouldn't be putrid, and it shouldn't be over the top where your entire family is having to clear the room, right? It should be a normal amount of gas. It should not be painful, if there's, and I think you make a good point. I think it's what you're trying to sort of say is everyone's normal is different. And I've had a patient who told me they had normal bowel movements. And then when I dug a little deeper, it was a bowel movement every 7 days. So he was under the impression that that was his normal. Right. That was totally normal. And that is not normal, right? So having that conversation about, okay, what is really normal? And although appreciating the fact that there's some variability between individuals, but really there's also something outside of that, right? That is not going to be healthy.
Okay. And so just some general suggestions. You mentioned fermented foods, but increasing fiber, drinking more water.
Yeah, absolutely. Especially if you're having trouble with those bowel movements, fiber and water can be helpful. More veggies. Like you had mentioned, sometimes we don't realize how big of a role diet has to play with our emotions. Kind of the same thing with our gut. If you change your diet, that's the easiest proof that what you decide to eat can influence your mood and your bowels. It happens sometimes overnight.
Wow. Okay. And it's true, that everyone's with the coronavirus right now is talking about the coronavirus 10 or 15 or weight people are putting on because in addition to maybe not sleeping their normal schedule because they're not having to drive into an office every day, sleep has been off for a lot of people just because of general anxiety. And then eating's been off, at least in the beginning. I think people are like, okay, we've been in it longer and pulling back the reins now and trying to readjust. So hopefully this information will hit at the right time when maybe they're focused on that. But what are some extra things we can do during this really unusual time to maintain our sanity? I've read that anxiety is through the roof for not just adults, but children now too.
The whole diet component of coronavirus, the whole coronavirus experience, right? It's this amazing invitation. There's tons of tragedy. Don't get me wrong. This is horrifying. And I wish that it did not happen. However, if we have to go through this, right, just like any other horrifying experience, if we have to go through this, then how can we frame it so that it's something that empowers us, right? And being stuck at home, there's a huge gift in that. And in that we have complete control over what we eat. Right? You go to the grocery store and you can decide. You don't have the temptation of a birthday party or a restaurant meal, right? You don't have to go out to that work dinner anymore where you're going to feel like an outcast if you don't get the fettuccine Alfredo, right? You can, and have a beer or whatever. You can really, it's this incredible opportunity to really manage what we're consuming. And you can do it at the grocery store, right? So that it's not in your fridge, it's not in your pantry. It's such a great opportunity to cleanse your kitchen and make these choices, stick to them, follow through, and really get the feedback of how does my body feel? How does my brain feel? What's my mood like? What are my bowels like? Now that I've really fully committed without those external pressures tempting me to go off track.
Okay, that's actually super helpful. But what about in terms of ways to manage anxiety right now?
Yeah, absolutely. So I think that controlling the things that we can, of course, is a big piece of this. So one of the other big foundations two of the other big foundations are exercise and stress management strategies. Now, it's my belief, my bias, that everyone should be in therapy and that meditation is the best medicine by far. Meditation there, and it's the best deal in medicine too, right? Because it's totally free. And that exercise is moving meditation essentially. So it's a great way to discharge a lot of the adrenaline or a lot of the stress. It's a good time for us to step away from our phones and our computers and just be moving, be active. And there's a ton of science about what that's doing in terms of endorphins and clearing adrenaline. So, and sometimes creating adrenaline. So just having a regular practice around that, and again, committing to it. There's some incredible opportunity that is coronavirus and the lockdowns associated, that we have a bit more time because we're not commuting. We get this incredible opportunity to like reframe our priorities and what our schedule looks like. What are we going to do with our day? And we have the opportunity to put meditation in there. We have the opportunity to put exercise in there. We have the opportunity to put cooking in there. All of these healthy habits. Like, who do I want to be on the other side of coronavirus? Like, what habits do I want to instill? And these ones that support our mental health are certainly at the top of my priority list. And I would invite others to consider the same.
Yeah, thank you. I totally agree with that. And I guess I'm wondering though, when somebody's feeling beyond anxious, when they're actually depressed, and so I don't know exactly what happens in the brain, but let's say the part that would have the spark to want to initiate exercise and connecting and doing all that stuff is dimmed down, right? Mm-hmm. So somebody isn't really feeling like they know they need to do the stuff, but they're maybe too sad or depressed or fearful or whatever, is a combination of things going on. How do you navigate that? I mean, is that you? It's interesting because you mentioned that everyone should have a therapist. You said that's your bias. Maybe this is a part of the recipe, but I'd like your thoughts and why actually that you think that.
Yeah. So, therapy is this, again, another opportunity for us to have a professional who has a tool belt of interventions that you shouldn't even really be able to perceive, right? But they can help you to explore some of these patterns of the way we think, patterns of perception that may or may not serve us, right? And sort of amplify the ones that do and help us to quiet the ones that don't. And just having someone who can identify those patterns and be aware of those patterns and support you in processing whatever your traumas are, because everyone's got them, is so valuable, so valuable. And it can take a little bit of time for people to find the right therapist. And I really encourage people to, when they're looking, it's like shopping or it's like dating, however you want it, whatever analogy you want to use.
Yeah.
To make appointments with maybe 3 or 4 therapists. And I know it's expensive and I know it takes time, but I love if someone has the opportunity to do it before they're in a crisis state so that they can have that established relationship with someone they appreciate, whose insights they respect. Mm-hmm. And then when they are in crisis, they know exactly who to go to. They don't delay getting the help. And hey, if it's someone who supports healthy people, then they can maybe push them towards personal growth a little bit more along the way in between crises, right? That inevitably come up. In the case of, like you asked, okay, some people are at that crisis point already. There are, there's a whole laundry list of medications that you can get from your primary care provider or a psychiatrist. And what's scary to me is, one, how addictive a lot of them are, and then how coronavirus is temporary. This is not going to last for the rest of our lives, or even, God forbid it did. Like, we will find a way, we will adapt and find a way to make it a new normal where we can all socially interact, physically interact again. So that's not going to last forever. But in this time, a lot of people are being put on medications that they will be on long term, well after the coronavirus resolves and whatever that looks like. So it's sad and scary to me that so many people, I think they're up by some ungodly percentage. I think it was 30% more prescriptions for benzodiazepines and SSRIs right now, or that was maybe a month ago, than in February of 2020. Wow. So really scary increases in the amounts of medications that are being prescribed. And I get it. Like, people can't go to sleep and they're worried about their family members and they're worried about money, and there's a lot going on. And yet we have all these tools that are free, there's so much literature about meditation being more helpful, about exercise being more helpful, about diet being more helpful than any of the SSRIs. So it's just a little sad to me. Although I get it, it's a little sad to me that so many people feel like they have to reach for that. There are other things that we can do, and Dr. Walsh's work is one of the tools that I employ at the clinic at North County Natural Medicine. And what Dr. Walsh did was he got into mental health in the late 70s with another doctor named Carl Pfeiffer. And they were looking initially at like sociopaths, at incarcerated people. And they were looking to see if there was some sort of pattern they could get to in their blood work. And eventually what they stumbled on was that whole blood histamine, zinc and copper ratios, and then something called urine cryptopyrroles were helpful in determining these certain patterns of under and over methylation, and then copper toxicity and this pyruria. And if we were able to sort of correct those things with using just nutrients, that a lot of the sociopaths would no longer be sociopaths, that depressed people would no longer be depressed. And so it's a tool that it's not for 100% of people, but I've certainly had enough success in my practice that I think it's worth doing for everyone. And intervening, it's also very safe, right? It's very safe to add these nutrients. So if we can intervene, get those numbers sort of into the functional range, and then see how people feel, the risk associated with that versus the risk of being addicted to Ambien or to Xanax for the rest of your life is much, much lower. And the benefit is that you get more balance. So especially in the case of zinc and copper ratios, with zinc, you get improved mood. Yes. Mm-hmm. You get improved immune function. Your hair starts to grow and your nails are longer and thicker and healthier. For younger kids, sometimes they'll get a little growth spurt afterwards and their acne will clear up. So what you see is not only we're intervening with a certain nutrient, but what you're doing is you're creating more balance and function and optimization in the entire body, not just in the brain and the neurochemistry. Although that is, of course, a piece of it. That's kind of how we arrived here, right? So Dr. Walsh's work, what I appreciate so much about it is that what we're doing is creating balance. And how you know you're doing that is because the side effect is that other things get better, right?
Do you mind giving an example? I mean, obviously not naming a patient, but just hypothetically, how the system works. Do you get a blood test? What's involved?
Yeah, so I had a great patient come in. He was a younger boy. I think he was 12 at the time we started seeing each other. He's probably 17 now. I haven't seen him for a while. He's just cruising on his plan. He came in because he was having a lot of social anxiety and his mom couldn't leave school. She would have to stay there with him in his class because he would have so much anxiety that he would just want to go home with her when she left. It was so sad. And he was like a Boy Scout and trying to go on campouts, and he would crawl into his dad's tent. And he's 12, he's like old enough that this should be a fun time for him. He should be playing with his friends and enjoying school, enjoying campouts. And he was just like totally overcome with anxiety. And even like the days before the campout, he would start to get really, really anxious. So he came in and we did the workup for him. And what it is it's blood and urine. So we take the blood, we have you avoid supplements for a couple days beforehand, take blood and urine, and then ship it off to the lab. And then we look at the different parameters when they get back. For him, it must have been the second follow-up, because the first time I saw him, we got the whole story. Then the second time, he had gotten a little bit of benefit from adding things like amino acids. And then, for me, that's kind of a guess. Like, okay, here, maybe these things could help you. And with him, he'd never drank alcohol. He'd never done cocaine. He'd never obviously like done these things that hijack our neurotransmitters, essentially. And sometimes I can elicit some sense from how you respond to different drugs or alcohol or even pharmaceuticals or over-the-counter things like Benadryl. So I didn't have that kind of information. So I was kind of guessing with amino acids. And then we got the information in the second follow-up. He said, "Hey, doctor, have you ever seen an old lady walking kind of a big dog? And it's more like the dog is walking her." I was like, "Yeah, where's this going?" And he's like, "Well, now I feel like I'm walking my dog."
Oh, that's so sweet. Oh, so it was an immediate result for him, or very soon after?
It was really quick. Yeah.
He felt the difference so profoundly to be able to give that analogy.
And kids say it in a way that adults, I think, can't always like find the language. But it's that idea that like your brain is controlling you sometimes. And now he was in control. He was the master of what was going on. And other adults have said similar things too, but not with like that picture. So yeah, I've had other patients where, maybe they're not 100% better in terms of their anxiety or depression hasn't completely resolved, but now they need less of their medication, so they don't have the weight gain and the low libido that they used to have. Now they have a little bit, more libido and they're happy with their weight, but they don't have the depression because they're on half of the dose that they used to be on.
No, that's great.
Yeah. It's been a little scary because people have wanted to get off their medications and been really attached to that. And I don't recommend playing with the medications, especially right away. It takes 4 to 6 months for this to kind of, run its course and do what it's meant to do. And then some people come down in medication, but I am not attached to them coming completely off of them. It's not that medication is bad. Mm-hmm. It's that we want people to have peace, to have stable mood.
Yeah. And I was just going to actually ask you about the medication piece, because I wouldn't want anyone who is on any medication to feel at all any shame or any feelings of like, for some people, it may literally be life-saving.
I have patients, they'll come in for a while and they need it for a year or two, and then they kind of, forget that they need it, or they get off of this Walsh supplements and there's nothing stressful going on in their life. So they go about their business, and then a few years later, they're back and like something happened. They went through a divorce or their parent died or something horrible happened. And now they're feeling like they need it again. So we just kind of reassess and get them back on track. And maybe I'm not attached. They might not need it again, or somebody else, the COVID thing. I had a patient, she was doing pretty well and she felt like it totally overwhelmed her and she got back on her medication, and there's no judgment. It's just all about what works best for you.
Yeah.
It's not a failure. It's just a recalibration for what you need in the moment.
Yeah. And what you're saying is making me think, when you're stressed or there's inflammation or there's dis-ease, there's things going on in the body, it taps your resources, right? Isn't this true? So basically if I'm understanding correctly too, some of those nutrient deficiencies are being caused because your body's calling for more nutrients to solve one issue, but then it's causing another.
Right, exactly. It's all about balance, right? Yeah. Too much, too little, in the wrong place at the wrong time. Hormones come up in this context as well. And certainly nutrients, having enough nutrients so that you can create the hormones that you need to keep your mood balanced is really important.
I was actually going to ask you about that because I think, my audience is women. And so with perimenopause or menstrual cycles or, even menopause, like I know for me when I'm getting my menstrual cycle, I don't know if I'm in perimenopause or not. I could sleep for 2 days. I mean, not literally, but I never had that when I was younger. And I think, what is that about? I mean, I'm just not as energetic as I normally would be. And I'm like, that must be hormones, I imagine. It's not it's not depression. It's just, I'm just tired. But
for anyone who's ever had a child, like, are you kidding me? Can hormones affect our mood? We all know.
Right.
Yeah. Just how the stereotypical like crazy pregnant lady or whatever. And then the just totally head over heels in love oxytocin laden mom, right? So those hormones certainly, of course, affect us. And as we go through these big transitions, like the onset of menarche for teens, and we can all relate to maybe what that was like for us. And then as we have daughters who approach teenage years, you get to see it all over again. And certainly that is affecting our mood and tolerance and patience for both moms and daughters. And then again, going through menopause, of course, each of these transitions affects our mood. I mean, that's just like the caricature of those stages of life, right? Is that people are irritable or crazed. And how do we do it with grace, right?
Yeah. What's the support system? Because I'll have friends who say, I don't feel like myself. I'm yelling at my family all the time. I don't know who I am anymore. They're like confused.
So
what do I do?
Foundations. I've had patients who change their diet and their hot flashes go away and they feel like themselves again, right? They just go to a vegan diet or they just go to a keto diet or whatever it is. They switch their diet and it works for them. I have other patients who try that and their hot flashes just get worse and worse, right? And hot flashes are a good measure because you can count them. They happen every day typically, and if they're starting to go down in severity or in frequency, then it's an easy thing to measure, right? Versus irritability. It's like, you kind of want to forget that. You want to forget that you yelled at your husband or your kids. So you're not counting it. But the hot flashes are something that are relatively easy. And so then when we add things like progesterone and some estrogen or some herbs or whatever's on the list that works for you, or seems relevant for you based on your labs, then having that resolve, we can kind of measure it and know that it's working. But I do think that it's a combination, right? Like you said, foundations of mental health, it's the same foundations for hormonal health: nutrients, diet, exercise, stress management, and good sleep. And if you've got all those under control and you still feel like a wreck, then go see someone and have those hormones measured. Progesterone's the happy hormone. It interacts with GABA in our brain. It helps us with sleep. And then getting enough estrogen, not so that you're a cycling woman into your 90s, but just so that you are at that baseline level that allows you to maintain your sanity and not have the hot flashes or vaginal dryness or night sweats that can make you feel crazy. So just enough to keep you at that level where your hormones are under control. They don't control you.
Mm-hmm. So I'm just curious. So when you see somebody who is anxious or depressed in your practice, you basically are looking at these, I'm just trying to make sure I get it. You're looking at how's their foundational health, right? Or, you're looking at that. You're looking at the emotional state. And then you're looking at maybe doing something like Dr. Walsh's protocol to assess if there's any deficiencies to be replenished.
Yeah, and Dr. Walsh also mentions toxicity, and certainly that's a big focus of my practice. So he mentions heavy metal toxicity, so to high levels of lead or mercury. We know from Flint, Michigan, and other places where poor children are being poisoned by lead in their drinking water. That has the ability to change IQ levels at very, very low levels. So at even below like CDC standards, you're already seeing a shift in IQ levels, especially in a developing brain. That is just so horrifying and awful. And in adult brains, when we're being exposed to heavy metals or mold toxicity or even chemical toxins, this can influence our hormones and then indirectly influence our mood. But particularly mercury, Mad Hatter's disease came from this whole idea that hatters, people who used to make hats, there was, in the felting process, there was mercury used. And so they would put on, like the Mad Hatter from Alice in Wonderland, right? To say, this crazy guy. And so people who are exposed to mercury go crazy. They are depressed. They have high rates of suicidality. And so if there is an exposure to heavy metals, whether it's from our drinking water or from amalgams or from fish or from, sometimes we don't even know where it's coming from, that can play a big influence on our mental health. And certainly anyone who has experienced mold toxicity will tell you that anxiety and depression comes with it. And the fatigue, right? The fatigue of having a high toxic burden is in and of itself depressing, right? You don't have the ability to engage in the world, in your life in the way that you want to. You're not achieving your full potential, which would be depressing for anyone.
Thank you. This has been so eye-opening and interesting. And it sounds like, I mean, I'm a fan of Western medicine for many things, but for me, you said your bias is that everyone should see a therapist. My bias is that you should have an amazing Western, traditionally trained doctor that you love, and you should have a naturopathic doctor that you love, because there's going to be certain things that with root cause issues that they're not going to be in your 7 minutes that you get with your primary care doctor. That's never going to be able to get addressed.
I couldn't agree more. I used to joke, like, if I'm in a car accident, take me straight to the emergency room, right? And not a joke, but please do, right?
Right.
I had my baby, and I had something called HELP syndrome, and then had a postpartum hemorrhage. So if I had my baby at home, I would have died, right? Like, it was bad. I got very, very sick. And here I am, like 19 months later, like I still am processing that. And my doctor, Dr. Cap in Sandison, he was incredible. Western trained. I was in the hospital. It was the absolute only place I should have been. Mm-hmm. And of course, I wanted to have a home birth. I wanted to do everything naturally, and I didn't want to be induced. But when my life was on the line, like, I needed to be in a hospital getting all of the benefits of Western medicine. And 100 years ago, 200 years ago, I wouldn't be here anymore. Mm-hmm. And so I feel very, very, very fortunate to have access to both. There's wisdom and value in both of these approaches. And I couldn't agree more. Have good doctors on your team from both perspectives.
I'm sorry that happened, though. That's really hard. So any exciting research in mental health that you want to share about? That I think, well, I already know a little bit that, this is something that you are sort of excited about. So can you share?
Yeah, absolutely. So one of the things that I'm most excited about is the research around psychedelics, because this is, it is using a substance. And I think there's a lot of criticism around this and social scrutiny, and there's a lot of biases and assumptions that go into this. And I still hear people call them drugs. And I would say I won't put them in that category. I don't think of them as illegal drugs anymore. Now, certainly they are still illegal. So don't go do them and get in trouble. And yet they're really medicine. And this plays out over and over and over again in terms of the ways they were used historically by indigenous cultures, in terms of what we see in the science, that they are really, if there were a medication that could be curative, like, these are in that category where you get really profound change in just one dose. Right. So they're not the type of medicine that most pharmaceutical companies like, because you don't have to take repeated doses and pay for them over and over for the rest of your life. No, you just take them once. And this is psychedelic assisted psychotherapy. Right. So I'm not suggesting that you eat mushrooms and go for a walk with your friends. I'm saying more the idea, and what's been studied for certainly end of life depression, for addiction, for several different mental health issues, diagnoses. Taking a psychedelic with a guide where you set an intention. So this idea of set and setting, you're with a trained guide who helps you set an intention beforehand, then is there with you on the journey or during the experience of the psychedelic. And all the gold of this, the value in it is the integration afterwards with a trained psychotherapist. And in that, what we find, and it's not for 100% of people, but the numbers are like 80% of people feel less depression, even a year later, right after one single dose. Mm-hmm. So the potential benefit here is astounding and incredible. And I happen to be in the camp that believes that this is part of the mental health epidemic. This is part of the solution to that. So where we feel so disconnected, where we feel so traumatized, where there is a lot of violence in the media and potentially in our neighborhoods, when we're experiencing that kind of trauma, that this is a way to relatively quickly make sense of it and find the gift in it and turn it around so that we become better because of it, not despite not despite our experiences, but because they help to ingrain who we are and who we want to help and how we want to contribute. So that experience of like ego disillusion and having that experience of your truth with a capital T, kind of that experience of all being connected, is what a lot of people describe when they've been through these psychedelic experiences. And so on the other end of that, it's hard not to be more compassionate. It's hard not to be, more empathetic. And those are things that create a healthier society from a mental health perspective and just from a societal perspective.
Yeah, I've heard a little bit about psychedelics on different podcasts. I think Tim Ferriss. There's certain people who are just huge proponents of it. I don't know enough about it. I think there's somebody, I can't think of his name, who's big in the meditation space. I think it was,
Ram Dass?
Yes. Guess he was on Oprah or something. So I've heard little bits and pieces, but what are the psychedelic drugs? What?
Yeah. So Michael Pollan has How to Change Your Mind is this incredible book, right? Like if he can do for psychedelics what he did for food, that would just be amazing and probably change the world. And he takes you through a lot of the science. And one of the fun parts of the whole psychedelic story is the story and the characters. So there was a lot of this was going on at Esalen in like the 60s. And there's a whole crew. And Ram Dass is one of these guys that was in that crowd. And then Rick Doblin is the creator of MAPS, which they have a group that's interested in doing a lot of the research. They are... So that's the Multidisciplinary Association for Psychedelic Studies. That's what Rick Doblin started, MAPS. And it basically what they're trying to do is put together research, and they've focused really on MDMA. But there are plant medicines, so like ayahuasca, San Pedro, psilocybin is a mushroom-related one. There's a bunch, and I couldn't even list all of them. Sometimes ketamine, which is legal. Ketamine-assisted psychotherapy can be done by IV by doctors and then by medical doctors. So you'll see ketamine clinics that are often associated with other transcranial stim therapies. So they're not insurance-based by any stretch, but that is something that you can get access to now. And a lot of people will describe, I've had patients who have said that's the most profound thing they've ever done. They've been on SSRIs for decades, and then they did a ketamine treatment, and now they're off of them, and they're doing great. So just there's kind of a spectrum, and I think there's some disagreement, and even in the psychedelic field, about what belongs in the psychedelics camp and what is more of a medication. Ketamine, of course, is like the horse tranquilizer. So some people will include that and other people won't. And then if it's synthetic, is that like LSD? Does that count or does it not? And Rick Doblin, he's like, it doesn't matter. They're all in there. And I'm a naturopath, so I'm like, oh, I think the plants are cool. But yeah, I guess time will tell. The research will tell, what people get different, kind of the different elements as they shake out. Maybe if one's better for alcoholism or addiction, or one's better for depression, or one's better for anxiety, or maybe one will be like call to you. I think that starts to get into more of the naturopathic herbal side of things.
Completely. Well, it's actually fascinating in what you talked about with indigenous cultures, probably using this stuff regularly, and then it just didn't become the norm anymore as, different things changed. And the same thing you mentioned with the, like the kefir and what's the word I'm looking for? Not the probiotics. It's
and kimchi, like all of these fermented
foods, which were absolutely parts of that's my ancestry. It was absolutely a part of the culture. And so you either had that in your home or you didn't. But, I think things kind of cycle back around, and maybe that's where we are at with the psychedelics. It's just interesting for people to be aware of, what the controversy is and what the discussion is. And I know you're all about the brain and brain health and science. So I was curious about that. But you've been amazing. Where can people learn more about your practice, Dr. Sandison?
Yeah, so we have, of course, the website, social media. both North County Natural Medicine and then Marama. We haven't really talked about dementia and Alzheimer's, but maramaexperience.com or northcountynaturalmedicine.com are both of those websites. And then you can find us on the same, what are the handles on social media, on Instagram and Facebook and Twitter.
Okay, I'll definitely link those up. And when I link up episode number 51, we do talk about, it was just before you would launch, or you were just about to launch Marama. So they'll hear your research on Alzheimer's and dementia and what you were about to launch there, and can go deeper for people who have family members with those issues. So this is always so enlightening and so informative. And I'm so grateful for your time today.
Of course. Thank you so much for having me. It's been an absolute pleasure and always a lot of fun to talk to you, Michelle.
Oh, thank you. This is Michelle Lamoureux, and you've been listening to the Good Life Coach podcast. Now remember, all of the show notes can be found over at thegoodlifecoach.com. Now, I have one favor before you sign off today. If you've benefited from any of the shows that you've listened to and really enjoyed the content, would you be kind enough to take just 1 minute and rate and review the show over on Apple Podcasts? It's how I know what's resonating with you, and also it helps other women find the show. Thank you as always for tuning in, and I look forward to reconnecting next Wednesday. Bye for now.